And here to weigh in are Democratic Representative Allison Schwartz of Pennsylvania and Republican Representative Bill Cassidy of Louisiana, also a medical doctor. Welcome to you both. Thank you for being here. We just saw the president speak. I don't know if you were able to see that too, but he was flanked by the senators. Among them, there were two independents as well, and specifically they said that the president said this would be the largest deficit reduction plan in a decade. Representative Schwartz, I'll get to you first. There have been some questions about whether this would truly bend the cost curve. Can you be sure it will?
Well, we do project out 10 years. That's pretty good. We're serious about tackling this incredible American challenge that we have, which is how to make sure that all Americans have access to buying insurance, and that we, in fact, also protect Medicare, and we help businesses, and that we contain costs both for families, for businesses, and also for government. And the Senate is feeling pretty secure about the fact that they're doing that. And I think we did in the House bill as well. And moving forward, it's one of the major reasons that we're doing this is to make sure we contain costs for our economic competitiveness, for our bottom line, for our budget, and because our families need us to take action on health care as well.
Dr. Kennedy, do you believe that this Senate bill has what it takes to cover enough people and also bring the cost of health care down?
Well, there's Dr. Cassidy, not Dr. Kennedy, but that's
Cassidy,
okay.
Rather.
You know, I was amused. I think this speech was more about politics than it was about good policy. The CMS recently came out with a statement that was very pessimistic about the impact of this bill, the one the president spoke about, upon the Medicare budget. Similarly, the CBO has said under previous iterations, it's not given its final report of this, that cost will increase by 8% per year with these bills. Now, that's worse than the status quo. That more than doubles cost in 10 years. So actually, I think that you have to take it with a grain of salt, because certainly the CBO would, that these will actually control costs. They increase the amount of governmental spending upon health care.
But Representative...
do you want me to respond?
Sure, go ahead. Go ahead, Representative Schwartz.
Yeah. Let me just say there's so many important aspects of this health care reform legislation, and they are really connected. What we're trying to do, of course, is to be smarter in the way we spend public dollars, making sure that Americans, working towards making sure Americans are healthier at the end of the day. And what we're doing is, yes, we're providing some additional subsidies for the first time for middle-income Americans, lower middle-income Americans to afford health coverage, and reduce the rate of growth in those health premiums, and slow the rate of growth in costs for Medicare. All of that over 10 years does help both our families and our businesses, and of course the bottom line for government.
If I could respond to that.
Of course.
The fact is that they actually predict an increase of about 10% in the individual market, that the small group market will also increase, but it will be offset by the federal subsidies. But despite the $730 billion in new taxes that the House bill had, and the estimated 5.5 million jobs lost that those taxes incur, that there's actually no improvement in their premiums.
Well,
their premiums stay about the same.
Representative Schwartz, the fear, hold on, Representative Schwartz,
appreciate that.
It is the fear of higher taxes to pay for this that will be socked to, aside from the upper income people, but then it trickles down because it's not necessarily, it's not inflation adjusted. And we saw with the AMT, the alternative minimum tax, that when that wasn't inflation adjusted through the years, it began to include a lot of people like doctors and like police officers and teachers, for example.
Well, we do need to fix the AMT, and of course that's part of what we're going to do as we move forward. And of course we have to deal with the whole issue of tax policy, and we plan to do that in the next year with the Bush tax cuts for the wealthiest expiring. But in the House bill, and it is different in the Senate bill, so it's one of those very serious, big, important issues that we have to reconcile in a conference committee, is that we're taxing a marginal tax on those who make over $1 million in family income. That's adjusted gross income of over $1 million. So we're really talking about the wealthiest Americans.
Okay.
This is less than 1% of Americans. So it's very few Americans that we propose paying some additional taxes in order to have all Americans have access to health coverage. And we do expect this to reduce the rate of growth in costs for health care.
Dr. Cassidy, let me finish up. Hold on. Let me finish up with Dr. Cassidy. You have treated uninsured patients. The Democrats have dropped the plan to expand Medicare, and they've dropped the public option, two things that Republicans didn't like anyway. Does this make the bill more palatable to you and the others on the other side of the aisle?
No, because I will disagree with my colleague, because actually I do not think it's a smarter way. I've worked in a hospital for the uninsured for 20 years. The only thing that controls cost is by putting the patient in the middle of the process. It has to be patient-centered. This is government-centered. It is a top-down, bureaucratic, kind of a centrally command economy way in which you control cost. That's why it was so easy to think of expanding Medicaid, which it does, to the tune of about $35 billion in new taxes on state taxpayers, and those won't just be the well-to-do, that'll be everybody in those states. And it also was so easy to imagine expanding Medicare. That top-down bureaucratic control is something that this group is comfortable with, but patient-controlled HSAs, which are patient-centered, are 30% less expensive than a traditional insurance policy. And they work because the patient's in the middle.
We're going to have to end it there. Representative Schwartz, I'm so sorry. We are running out of time, but I'd love to have you both back so we can continue this discussion. It is far from over, so I hope you continue to join us on Fox Business. Representative Schwartz, Representative Cassidy, thank you so much. We do have a news alert. You're welcome. Robert Gray.